This is Radio Health Journal. I'm Reed Pence. This week, getting impatient with social distancing.
We're getting on top of the situation. All of us doctors are asking people to just hang in there and watch ourselves succeed.
When will it all end? When Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We're looking at a possibility of 1 billion climate refugees by mid-century.
The next looming global crisis. Then,
we look at housing today, and it's a nightmare. Homelessness is increasing around the country. I think a quarter of tenants spend more than half their income on rent.
A deep dive into the housing crisis plaguing America's landscapes. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
America is getting impatient. After a little more than a month of social distancing, working from home or not working at all, teaching kids from home and waiting for the curve to flatten, many of us are longing for a return to normalcy, or at least some semblance of it. From the White House to Wall Street to Main Street, a lot of people are thinking we've done this long enough. But the experts are saying not so fast.
Public health people and the infectious disease docs keep asking the virus, where are you going? How intensely are you being transmitted? And that influences our concept of social policy because, of course, we would like to see this epidemic come to as much of a close as we can bring it to as quickly as possible.
Dr. William Schaffner is professor of preventive medicine and infectious diseases at the Vanderbilt University School of Medicine and a former official with the CDC.
Yeah, I'm worried that there are people who, for very good reasons, not just cabin fever, but economics, they see dire economic prospects as they look in their crystal balls. They want to open things up again. And there's the tension.
In spite of the tens of thousands of deaths in the United States, social distancing and sheltering at home have worked. Without those measures, the pandemic would have been far worse. But now some people figure, okay, we're done. It worked. Let's open up the country. But that would throw away all the success we've had.
We're getting on top of the situation. All of us doctors are asking people to just hang in there and watch ourselves succeed.
Dr. Gary Slutkin is an epidemiologist formerly with the World Health Organization and now head of Cure Violence Global.
Right now, if you were all to be freed, would you want to go to a restaurant really? Would you want to get in an airplane? Would you go to the movies now? It isn't safe. So let's just hang in there until it is safe and we can all show you, we can show each other that it really is safe. We're not there yet.
We're beating the models. So far, so good with social distancing, and we have to keep on doing that for a while. If we relax physical distancing, if we get close to each other again in work and play, the virus will have another surge. We'll have a second wave. That curve, which is starting to go down, will have a little dip, and it will start right up again.
And while economics are a big reason some people want to open up the country, a second wave of illnesses and thousands of deaths would be disastrous for the economy. We can't stop social distancing too soon. So the proper question for Slutkin and Schaffner is really, what will it take before we can safely start to return some things to normal?
I think it's two things. One is that the number of new cases every day in your community. Now, you can know this from the website of your city or state. The number of new cases is going down instead of up. And they're down to a level that is low enough and medical care can handle it. And the last thing I would add really is that your health system can show that when there is a case or two cases, that they can get right on top of it and prevent any further spread.
A lot of different benchmarks have been proposed. The one I like the best, because it's very clean, is number of patients admitted to your hospital, wherever you happen to be, your hospital with laboratory-confirmed coronavirus infections. Those are the most severe infections. They're absolutely well diagnosed. And if the number of admissions starts to plateau and then go down, then I start to smile. We'd like to see a sustained decline over a week into a second week. Then I think we can get reasonably comfortable that transmission has, if not been interrupted, but has been substantially reduced. And when that happens, I think in a staged fashion, we can start opening things up. I think we can see people going to work, and during that period, we'll still have to maintain social distancing. We'll still have to be wearing our masks or facial protection.
Schaffner says the likely first activities to be rolled out include work and then preparations for school this fall. But don't count on events that draw big crowds, like concerts or baseball games, or even churches or football games later on, to be back to normal soon.
Those are the things that we all think about and are very, very popular in American culture, but they surely do bring people together very, very closely. Travel to, travel from the events, all the social gathering that occurs, the tailgate parties, the restaurants, the bars, everybody's having fun and getting close together and reacquainting themselves. Boy, that's an environment that the virus would like.
However, there are some people the virus doesn't care about. They're the ones who can work on a frontline job or be in a crowd and know they're not likely to get sick. Those are people who've already been infected with coronavirus. Maybe they didn't even know they were infected. But if COVID-19 is like other viruses, those people are very likely to be immune from infection for now. They can be around those who are contagious without worry, and they may be the ones who we build the recovery around.
During this next month, we are going to see the availability of testing for antibodies in the blood. And I think some of these manufacturers are going to come out with little cassettes such that you can do a quick finger prick and get a readout from your cassette within minutes whether your body has developed antibodies to this coronavirus, indicating you've had previous infection, you're one of the persons who got infected, and you're likely to be protected now. You don't have to worry, at least in the near term. So there are schools, there are businesses and others who are trying to figure out how to use this test in order to guide the transition back to normal.
The United States still has no idea how many of its residents have been infected with COVID-19. Testing of active infections isn't where it needs to be, let alone testing for old infections. But Schaffner says considering opening up the country again with immune, previously infected individuals depends entirely on how many there are.
If it's 70% that have already been infected, many unawares because we have asymptomatic infection, then you can let the immune people come back to work first and continue to protect the susceptibles for a while. But if the proportion of immune people is really rather low, as many of my colleagues think, then I don't think it can help us very much in this planning.
And Schaffner says it's no sure thing that people who've had coronavirus will be protected for all that long. We may be able to rely on them to open up the country at first, but then what?
Reasoning by analogy from infectious disease generally, but particularly from the human coronaviruses, these antibodies should signify that you're protected in the short term. The human coronaviruses protect someone for about a year, and then protection begins to wane, and people can be reinfected with the coronavirus and get another cold. That's the human coronaviruses. This is a rogue coronavirus, and we don't know whether it, as I like to say, has read the textbook and knows what to do. So we don't know really about the duration of protection after recovery yet.
So that means a vaccine or an effective treatment may be essential for all of us before we can really get back to normal. And that's a year or more away.
If protection is going to be relatively short-lived, then we really need to hope that these many efforts to develop a vaccine or vaccines come to fruition and are successful. And it might well be that in future years, in the fall, we're rolling up both sleeves. One side gets your flu shot, the other side gets the coronavirus shot.
However, no matter how we roll out opening up the country, if we don't have a vaccine first, there will be an uptick of cases. It's just a question of how big that bounce will be. That will depend on not opening up too soon or too much, and just how seasonal the virus really is.
I think that's the general mode of thinking of most people in public health and infectious diseases, that we will get some summer respite because this is likely to be a somewhat seasonal virus, because it's a respiratory virus akin to influenza. It's not as dominantly, strikingly seasonal as is influenza, however. And then come the fall, there will be a gradual recurrence. That's the anticipation. And that's going to be still too early for the vaccine to be ready, we're afraid. So we'll be back to some variant of what we're doing today. It probably won't be that committed as it is, but variations on social distancing will be with us. Virtual business meetings, worshiping at home rather than going to religious services, some variant of sheltering at home.
By then, we should have plenty of testing. It's possible to mandate testing of the contacts of those who are infected and the quarantine only of those who come up positive. That would protect everyone else and allow a little bit of easing of sheltering in place.
And that would be the best plan. I just wonder whether there'll be public health fatigue. We have a finite and not sufficient public health structure in this country, and I don't know whether it can sustain itself for that long.
However, no matter when America gets back to work and to play, it's likely we're a changed nation. Some things will be small. Handshakes may be replaced by a wave or a bow or an elbow bump. We may be more likely to keep our distance from others.
Some of that will happen. I would not be entirely surprised if next fall, in influenza coronavirus season, we start seeing people in public wearing masks much more frequently, akin to what happens in Asia now. So those may be changes. Virtual meetings instead of in-person meetings in business and in other organizations. Less business travel. All those things wouldn't surprise me.
However, for millions of Americans, the changes will be big and permanent. Some businesses will never reopen. The way many others work won't be the same. We can't just go back to the way things were before. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
It's really important to share our emotions and learn how to express how we're feeling through this process, right? Learning how to talk about your emotions, that's part of resilience.
Strategies for coping with stress and anxiety during COVID-19.
The nursing homes have been hotbeds of COVID infections. How are they making sure the virus doesn't get in?
I've been in this business for over 3 decades, and this is the tightest control that I've ever seen.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.